This video explains the main steps of administering alteplase and dornase in a conventional chest tube with a thalquick adapter. The detailed protocol of the procedure is available on the MUHC intranet in the Policies and Procedures section. Search in the alphabetical section Drains. A nurse can administer alteplase and dornase in the pleural space only if the training with an educator was completed. If no nurse with training is available, the doctor or the nurse practitioner will have to do the administration. Before starting, check that there is a thalquick adapter with a needle-free connector installed on the drain line. The doctor or nurse practitioner must install the thalquick drain adapter, not the nurse. At any time, the nurse can install the needle-free connector. Here are the contraindications to alteplase and dornase administration: an allergy to alteplase or dornase, pregnancy and/or breastfeeding, presence of a bronchopleural fistula, history of pneumonectomy on the infected side, or in the last 5 days, no stroke, major hemorrhage, major trauma, or major surgical procedure. This is the equipment that will be required. Equipment required to take vital signs, 4 alcohol swabs, prepared syringe of alteplase, prepared syringe of dornase, 2 prepared syringes of 30 ml of sterile normal saline, hemostatic clamp, and 4x4 gauze. Refer to the procedure for reconstitution of medications as needed. Before each administration, wash your hands, wear appropriate PPE if the patient is in isolation. Identify your patient by using double identifiers. Explain the procedure to the patient. Take vital signs. Assess your patient's pain. Clean work surfaces. Clamp the thalquick chest tube adapter with the white clamp and clamp the chest tube under the thalquick chest tube adapter using a hemostatic clamp and a 4x4 gauze. The medication could leak into the drainage system if only the thalquick chest tube adapter is clamped. Clean the needle-free connector for 15 seconds with an alcohol swab and let it dry. Attach the syringe containing the alteplase to the needle-free connector. Turn the valve of the 3-way connector so the off is towards the capped end, allowing the drug to go into the patient. Inject the alteplase. Remove the empty syringe. Clean the needle-free connector again for 15 seconds with an alcohol swab and let it dry. Attach the syringe of sterile normal saline to the needle-free connector. Rinse with 30 ml of sterile normal saline. Remove the empty syringe. And repeat the same step for dornase. Turn the valve of the 3-way connector so that the off is towards the drain. Leave the hemostatic clamp with the 4x4 gauze and the thalquick chest tube adapter clamped. After 1 hour, remove the hemostatic clamp from the chest tube and unclamp the thalquick chest tube adapter. Place the drainage system under wall suction as prescribed. The following monitoring is required after the administration of alteplase and dornase: evaluation of the drain output using the FOCA acronym every hour for 8 hours, and check the vital signs every 4 hours. Please notify the attending physician or the nurse practitioner immediately in the following cases. Be sure to carry out an assessment prior to calling: suspected allergic reaction to the medications, rapid onset or intensification of chest pain, hypotension with a systolic blood pressure less than 90, or the appearance of a new episode of tachycardia with a heart rate greater than 120, onset or worsening of dyspnea, new episode of oxygen desaturation with a saturation less than 90%, or the appearance of hemoptysis, difficulty injecting medications or rinsing the catheter, bleeding at the site of the catheter or through the dressing, presence of a suspected subcutaneous hematoma, any change in color from the drained pleural fluid. If blood is already present in the pleural fluid, drainage of more than 200 milliliters per hour for 4 hours, or drainage of 500 milliliters or more immediately after unclamping the drain. Document the following after each administration. Vital signs in OASIS or MEDURGE. The volume of irrigation on the pleural drainage documentation form, DM 2569, or on the input and output sheet in MEDURGE. Tolerance to treatment or any side effects in the progress notes using the DARP recording method. In the computerized medication administration record, or CMAR, signed for the medications administered.